leaders from the health department, and I think they set up the talking points very well. We're excited at Genesis to be part of the solution for our community. It fulfills our mission to care for our community, and we're really fortunate to do this together with Community Healthcare and with Unity Point Trinity. We feel that we have great working relationship with our local health departments in both Scott and Rock Island County, and that's allowed us to actively participate in the 1B, and it also made it very efficient for us to immunize the healthcare workers in the 1A group prior to this. So as was mentioned, we'll be focusing on the over 65 population portion of the 1B. We have relationships with many of those patients, and we'll work with KSI and make sure we take care of the patients who may not have an established relationship with the healthcare system, as Ed described. We know these patients. We already have large rosters. We have had more than 12,000 patients registered by our physicians, and we continue to register patients. So we have our patients covered. That's the message I want to let them know, that we will get to you. I would reinforce that it is going to take many weeks to get through the 1B group, the large population, and we have limited vaccine supply. We're hoping that this weekend, in the weeks ahead, that we'll be able to administer somewhere around 1,000 vaccinations in Iowa and a similar number in Illinois to the 1B population. Our goal is to make sure that when we have vaccine and we receive vaccine, that we can quickly administer that and get it distributed so that by the next week's allocation, we've completed the previous vaccinations for the first vaccine in that 1B group. So our commitment is to turn around the vaccine within that 1 week period so that we're ready for the next shipment and we can continue moving through the list. It will take weeks. We hope that the vaccine supply will continue to increase in the weeks and months ahead so that we can go faster. We have capacity to do up to 1,000 vaccinations a day between our Iowa and Illinois locations. We just don't have the supply to do that right now. But as the supply increases, we'll ramp up to that level and beyond if need be. In addition to participating in the 1B vaccinations for the 65 and above group, we're partnering with the health departments just like Unity Point and CHC to support community efforts around vaccinating the priority groups, the tier 1, as was mentioned in Iowa. And we're happy to continue that partnership through support of staff for the community clinics and through use of our occupational health team for some of the employer immunizations for the priority groups. So we'll continue to do our part. And again, I am very happy that we're able to meet our mission to care for our community and do that in partnership with the health department, Unity Point, and Community Healthcare. I will just take one question from the chat while I'm on my time. There was a question about flu season, and I'd welcome any further comments from the health department team. But the question was, how's the flu season going? It's been a light flu season, and we see that. Are we seeing that here? And the answer is yes. It's been a very light flu season. We've had minimal flu cases across our clinics and in our hospital. The other part of the question was, how were vaccination rates? Our vaccination rates for influenza this year were similar to previous years. But what we're seeing with a very low flu season is what we know will work for COVID and has worked for COVID. When we avoid large gatherings, when we wear our masks, and when we practice, good hand hygiene, we can prevent the spread of viruses like COVID and flu. So that's what we have to continue to do as well while we work through this vaccination process. This is absolutely the wrong time to let up our community efforts around stopping the spread of viruses in our community, both the flu virus and the COVID virus. So I would just continue to remind everyone, wear your mask, maintain social distancing, avoid large gatherings, and wash your hands.